Hi everyone, this is Dory Malazano from NASDAD. Thank you for joining us. Just going to wait one more minute to see if anyone else joins, and then we will go ahead and get started. Okay, so I think we can go ahead and get started. Thank you everyone for attending our webinar today on ADAP considerations after open enrollment. I'm Dory Malazanov. I'm a manager on the Health Systems Integration team here at NASDAD. Before we get started, I'm just going to cover a few housekeeping items. First, everyone should be muted by default as soon as they join. If you have any questions, please use the chat feature. We'll have some time for Q&A at the end of the session, but feel free to send questions as they come to you, and we will address them towards the end. Second, this webinar is going to be recorded. Slides and a webinar recording will be available after the webinar. I will send them via email to registrants within a couple of days. And we will also be sharing a webinar evaluation that we hope everyone will complete, so be on the lookout for that as well. So with that, let's get started. So first, here's a brief overview of what we're going to cover today. First, I'll provide an overview of premium tax credit reconciliation. I know most of you are veterans when it comes to this, so we won't go too in depth, but we just wanted to provide a quick refresher. There have also been some slight changes to tax forms for 2018, and I will talk about those. Then I'll provide some policy updates related to the marketplace and the private insurance landscape overall. Next, we'll talk about Medicaid and Medicare periodic data matching, which relates to how to help clients who have two types of coverage. This will be followed by a discussion about helping clients resolve data matching issues, which applies when the marketplace requires a client to provide additional information in order to determine their eligibility. There have been some changes to the rules there that I want to bring to your attention. Then my colleagues from JSI will join us to discuss some of the resources available through the APTC Center. And then finally, we will have some Q&A, time for Q&A at the end. So first, an overview of premium tax credit reconciliation. This is probably very familiar to you all by now, but a little refresher doesn't hurt. Here is the life cycle of APTCs. Consumers receive advance payments of premium tax credits when they apply for coverage, which is reflected in a discount on their monthly premium. Then they must report changes to income or household size throughout the year to ensure that their APTCs are as accurate as possible. This is important because it protects against possibly needing to repay APTCs at tax time. And then finally, you file federal taxes for the year and reconcile APTCs. If you did not receive the right amount of APTC during the year, you might get a refund or have a tax liability. And if you need more information about this, we also have a webinar from last year dedicated to tax filing, and the JSI's APTC Center has a lot of information as well. Our webinar from last year is available on our website. Here's a quick reminder of the tax forms that you need to know about related to marketplace coverage. First is Form 1095A, which I will explain more in a moment. Forms 1095B and 1095C are for consumers who had minimum essential coverage from another source besides the marketplace and who need to verify on their tax return that they had coverage as required by the ACA's individual mandate. Form 8962 is used for tax credit reconciliation, and Form 8965 is for consumers who are claiming an exemption from the individual mandate on their tax return. Although the mandate has been zeroed out effective this year, it is still in effect for the 2018 tax year. This is Form 1095A. Consumers get this directly from the marketplace. It has information about APTCs they receive throughout the year, and they use it to fill out Form 8962. Consumers should have gotten their 1095A forms by now. They usually arrive in the mail around mid-February. They might also be available through consumers' marketplace accounts even earlier than that. Consumers whose 1095A forms contain errors should call the marketplace call center as soon as possible to request a corrected form. And consumers should also call the marketplace as soon as possible if they have not yet received the form 1095A. This is form 8962, which is used for tax credit reconciliation to make sure that the amount of advanced tax credit received throughout the year is accurate based on the consumer's actual income. So if the total APTCs received is less than the amount of tax credit the person is actually eligible for, they get a refund. And likewise, if the amount they received in APTC is greater than what they're eligible for, they have a tax liability. The information on Form 8962 then goes on your tax return. For most people, that's Form 1040. The 2018 version of Form 1040 has been revised, so there are some new schedules and line numbers now. However, the process for reconciliation has not materially changed, but there are two new Form 1040 schedules that are necessary for reconciliation. Schedule 2 and Schedule 5, pictured here. This is where you put information about tax credits that previously went directly onto the Form 1040. Now it goes onto the schedules instead. Here's a close-up of Form 1040, the form that you use to file taxes. It will include information from Schedules 2 and 5, which include information from Form 8962. This is different from previous years where information from Form 8962 went directly onto the 1040. Additionally, there's been a slight change to the 1040 related to how and where to report exemptions from the individual mandate. Again, this is not materially different from previous years, but the line numbers and format have changed. I just wanted to note a few additional changes to the 2018 tax forms. Like I said, this does not materially change the reconciliation process, but there are changes worth knowing. Forms 1040A and 1040EZ are no longer available. Most people will now file taxes with Form 1040 or 1040NR, which is the form for non-resident aliens. Form 1040 has been redesigned with new schedules, as I explained before, and Form 8962 has been revised to reflect these other changes. It hasn't been changed in any significant way, but it's been revised so that all cross-references to the other forms are up to date. Repayment caps. So the ACA provides for repayment caps based on income. This means that individuals who receive excess tax credits and must repay that excess will have a cap on their liability. So individuals with incomes above 400% of the federal poverty level do not have a cap and must repay everything. Individuals with incomes below 100% are not technically eligible for tax credits. However, they might have received tax credits anyway due to an error in how the marketplace calculated their estimated income for the year. So assuming that this error was a true error and not a result of an intentional misrepresentation, they will not have to repay everything that they received. The marketplace will still calculate their tax credit eligibility based on their actual income using the same formula that it uses for everybody else. And this typically means that they will end up getting a refund subject also to the caps here. This is referred to as a safe harbor, and I'll refer to it a couple of times during the presentation. Failure to file and reconcile. So in previous years, the marketplace sent notices to consumers who failed to file and reconcile the prior year's tax credits before discontinuing tax credits on this basis. So this notice is no longer mandatory. CMS says that it will continue sending these notices to consumers in healthcare.gov states where possible, but it's unclear whether they will, and state-based marketplaces are no longer required to send these notices either. However, even if the consumer does not get a notice and they still lose APTCs, they can still lose APTCs if they don't file and reconcile. So it's important to remind consumers to file taxes and reconcile their APTCs every year. If you're working with someone who did not file and reconcile for 2017, they might lose their 2019 APTCs and they will likely not be eligible for APTC in 2020. until they're up to date on their tax filings. So it's not too late, but they need to file and reconcile as soon as possible. Consumers who haven't filed for 2017 yet should do so as soon as possible to reduce late fees and penalties. There's more information on the IRS's website about deadlines, penalties, and instructions for late filings. This is a review of HRSA HAB PCN 1401, which provides that Ryan White recipients may cover client tax liability associated with overpayment of APTCs and must also pursue any refunds that clients receive following reconciliation in cases where Ryan White funds are used to pay for coverage. So something to keep in mind is that we have received reports of cases where the IRS has asked clients to submit justification of third-party payer when ADAP covered the overpayment. We think that these are anomalies and we expect most people will not be asked for this, but we just wanted to let you know that it has happened in the past. So some things to keep in mind for 2019, reminding clients that they need to file and reconcile taxes every year, making sure that clients understand the importance of maintaining accurate information on their marketplace application throughout the year if they experience any changes. We also encourage and support ADAPs in developing policies and procedures for handling APTC overpayments and underpayments. And remember that the individual mandate is still in effect for the 2018 tax year. So those are the taxes that are coming up, but will be zeroed out beginning with the 2019 tax year. ADAPs can refer clients to professional tax advice if needed, such as H&R Block. Qualifying taxpayers can also get help through the IRS's VITA, Volunteer Income Tax Assistance, VITA, or TCE, Tax Counseling for the Elderly programs. So now I want to go over some updates to marketplace policies and non-ACA compliant products as well. So first, special enrollment periods. As of early 2019, there are some new restrictions on plan choice for enrollees who want to switch plans through an SEP. The implementation date for healthcare.gov was February 2019, last month, and SBMs are required, state-based marketplaces are required to adopt this policy as soon as possible. Before this rule, consumers who switched plans through an SEP could choose from any plan that they wanted. But now their options are limited and they will have a restricted range of plans to choose from. Typically, they will only be able to switch within the same metal level as their current plan. So here are the 3 criteria for determining whether this new rule applies to someone. The new rule applies to enrollees who, first, are already enrolled in a marketplace plan or are joining a family member's existing plan as a dependent. So it does not apply to people who are newly enrolling in coverage through an SEP, unless they are a dependent, in which case the rule has some implications. For someone who's being added to an existing application through an SEP as a dependent, if they don't already have coverage on their own, there are 2 options. They can be added to the existing family plan, or they can be placed in their own group and they can enroll in any plan that they want. But the family members who are already enrolled in coverage on that application cannot switch plans just because they're adding a dependent. And just to clarify, this rule applies to dependents who qualify for any SEP. It's not limited to the SEP that's for new dependents. So what that means is that a person who is joining an application as a dependent, regardless of whether they've already had coverage or not, and regardless of the SEP that is allowing them to join that application, will be able to join the existing plan or join their own plan, but other family members cannot switch plans just because they're adding a dependent. Second, the enrollee must be eligible for one of a number of SEPs that the rule applies to. There are some exceptions, but the rule generally applies to the most common SEPs, such as changes in household size, a permanent move, or losing your marketplace coverage because, for example, you got divorced or you turned 26 and you aged off your parents' plan. And third, this only applies if the enrollee actually wants to change their plan. So in most cases, enrollees will only be able to choose from plans within the same category as their current plan. So if you have a bronze plan and you get an SEP because you move to a new county, you can only choose from other bronze plans. So an assistor tip here when enrolling consumers, make sure they know that their ability to switch plans will be limited if they qualify for an SEP later in the year. And they most likely will be locked into the metal level that they choose until the next open enrollment. Another change beginning in 2019 relates to voluntary plan terminations. Enrollees who want to cancel their plan can choose to have a same-day policy termination now. Under the old rules, if you wanted to cancel a policy entirely, you had to pick a termination date that was at least 14 days into the future. You might have been able to cancel coverage earlier if you had multiple people on the application and then you were only canceling coverage for some people, but cancellation of the entire policy, including cancellations for policy with just one person, required 14 days notice. So this meant that depending on the day of the month when the termination was requested, the enrollee might be on the hook for another month of premiums if the 14-day notice period gets them into the next month. As of July 2018, healthcare.gov enrollees can choose to terminate their plan right away, or they can pick another date in the future, but they are no longer required to give the plan at least 14 days notice. State-based marketplaces may choose to implement this policy as well, but they are not required to do so. Non-ACA compliant coverage. So we've talked about these on previous webinars, and I won't get into too much detail about what these plans are, but I just wanted to provide a quick reminder about some of the new coverage options that we expect to start seeing more often, and to just talk about some recent coverage about these types of plans. The two types of plans I'm referring to are association health plans, AHPs, and short-term limited duration insurance. So first, the Washington Post recently published an article, it was last month, touting the benefits of AHPs. The article was informed by an organization that was set up to promote these types of plans and describes them as promising, consumer-friendly, generous plans that cost less than ACA coverage. This is not our position. History has shown us that AHPs may seem strong at first because they're able to attract lower cost enrollees and offer generous benefits at lower cost, but the risk pool deteriorates over time, causing the AHP to raise rates, reduce benefits, or even become insolvent. These plans have been around for a long time. They have a history of fraud and insolvency. So we continue to caution folks that these plans might be inadequate for people living with HIV. While they might be cheaper or seem cheaper at first, they offer less coverage than ACA compliant plans, and they don't comply with many ACA rules and protections. It's important for staff providing enrollment assistance to help clients assess all their coverage options, which includes comparing AHP coverage to what is available in the ACA compliant market. This is especially important for self-employed individuals who are now able to buy these plans for the first time. That was never allowed before. Most other people who have access to AHPs will have them available to them through their employers. As for short-term plans, recent news and analysis continues to find what we've always known is true about these plans. They are often deceptively marketed to look like ACA compliant coverage, even though they're not, and they provide inadequate coverage to people living with HIV and other chronic conditions. They may seem affordable, but they cover very little that a person living with HIV would need. So they end up being prohibitively expensive in the end. State regulators are currently grappling with how to monitor and regulate these plans. Regulators in a number of states have said they don't have capacity or authority to properly regulate them. They lack ability to widely disseminate information about their dangers to the public, and they just generally lack data about which issuers are selling them and how they're being marketed. So all this just means that consumers will depend on enrollment assisters such as yourselves to help them understand the limitations of these coverage types and to avoid enrolling in inadequate plans that don't meet their needs. These are just some links to recent analyses of short-term plans and AHPs. I have a number of these resource pages in the slide deck, which you'll be able to access when we circulate the deck to everyone after the webinar. Next, I want to talk about periodic data matching. This can get a little bit weedy, so please bear with me and remember to submit questions through the chat box and I'll address them later. So the marketplace periodically checks for consumers receiving APTCs who are also enrolled in Medicaid, CHIP, or Medicare that qualifies as minimum essential coverage or MEC. And the marketplace will send notices to these consumers. The notice lets consumers know that they're enrolled in 2 types of coverage and explains next steps to avoid or mitigate financial consequences. The bottom line is that these consumers are generally not eligible for APTCs, and so the consumer's options and next steps depend on the type of coverage that they have. So although most Medicaid coverage is considered MEC, there are some states where Medicaid for pregnant women and medically needy individuals is not considered MEC. Also, Medicaid that provides a limited benefit package is generally not considered MEC. Some Section 1115 demonstrations, sometimes referred to as Medicaid waivers, are also not considered MEC. These are usually the waivers that provide limited benefits, such as family planning services, emergency services, etc. However, states that have expanded Medicaid, for example, through a waiver, that coverage likely is MEC. Medicare Part A is also considered MEC, and so is Part C. So eligibility for APTCs depends on whether the consumer is required to pay a premium for Medicare Part A or not, and I'll go into some more detail about this shortly. So Medicare periodic data matching. Consumers cannot receive APTCs if they have Medicare Part A. So when they receive this notice from the marketplace, the PDM notice, their next steps depend on whether the consumer pays a premium for Medicare Part A or not. If the consumer has Part A for free, as most people do, they are completely ineligible for APTCs and they should cancel their APTCs immediately. They might have to repay APTCs for months in which they also had Medicare Part A or C. They're also encouraged by this notice to enroll in Part B if they haven't already, and to drop their marketplace coverage. They aren't technically required to drop their marketplace coverage, but most people will want to do this because the marketplace plan will duplicate the Part B coverage, and Part B is probably more affordable because they won't have APTCs anymore. Keep in mind that eligibility for free Medicare Part A is a bar to APTC eligibility even if the consumer does not actually have Part A. So most people will be automatically enrolled in free Part A, and dropping it isn't really a viable option for most people because if you do that, you will also lose your retirement benefits and you have to repay all benefits that you've already received. But even if someone does decide to terminate Part A, or they never enroll in it, for example, because they're part of the group of enrollees that don't get enrolled automatically, even if they don't have Part A, they still cannot get APTCs just by virtue of the fact that they are eligible for free Part A. But this applies only to people who get Part A for free, as most do. Now, if the consumer pays for Part A, they should compare that to their marketplace coverage and see which best meets their needs and budget. They could be eligible for APTCs because they are required to pay a premium for Part A. However, they cannot get APTCs if they actually enroll in Part A or C, and they might have to repay APTCs for months when they also had Medicare. So a consumer who must pay for Part A but wants to get marketplace coverage with APTCs must first drop their Medicare. Keep in mind, though, that consumers might have to pay a late enrollment penalty if they decide to enroll in Medicare in the future. So consumers who get a PDM notice letting them know that they're enrolled in 2 types of coverage will have to take action because the marketplace is not going to end their enrollment or the APTCs automatically. The consumer has to follow the instructions in the notice. However, CMS recently announced that beginning in winter 2019, healthcare.gov will have functionality to automatically end APTC for enrollees that are enrolled in both Medicare and the marketplace. Some people might also have their coverage automatically terminated altogether. As you recall, there was a new attestation question on the marketplace application this year asking whether the consumer wants to allow for automatic termination of coverage if they're found to be enrolled in other qualifying coverage. So if someone agrees to that on their application, the exchange might also terminate their coverage altogether. But regardless of whether consumers agreed to that question on the application, beginning in winter 2019, CMS has announced that healthcare.gov will have functionality to automatically end APTC for people who have both Medicare and the marketplace, and this could go into effect as soon as the winter of this year. Medicare PDM notices are not posted on a consumer's marketplace account, they're sent by mail only, and they will only go to people in healthcare.gov states. However, consumers in state-based marketplaces are still subject to all the same rules and should follow the same instructions. Sample notices with instructions can be found on CMS's website, and I will provide a link in the resources section. A couple more things to keep in mind about helping consumers who have both Medicare and Marketplace coverage. Consumers who want to cancel their Marketplace coverage and get Medicare Part B instead should wait until their Medicare enrollment is confirmed before canceling their Marketplace plan. Also, even though consumers have the option to postpone Part B enrollment and keep their Marketplace coverage for the time being, as I mentioned, that would be with or without APTCs, depending on whether they get Medicare Part A for free or not, they might have to face significant late penalties when they do eventually enroll in Medicare Part B, and these penalties can be as high as 40% of the Part B premium, so it can be quite steep. So as I just mentioned, consumers who become eligible for Medicare Part B but don't enroll right away might face a late enrollment penalty. Sometimes this happens because a consumer doesn't know the rules about APTC eligibility or doesn't understand that Marketplace coverage isn't interchangeable with Part B. They think that they're buying what's the equivalent of Part B coverage through the Marketplace. It's a misunderstanding, it's a common one, but it can still result in some serious financial consequences. So if a person in this situation gets a PDM notice, it will advise them to enroll in Part B and end their Marketplace coverage. But this leaves the person with two really costly options. They can either keep their full cost Marketplace plan, or they can pay a late enrollment penalty for Part B. And like I said, this can be a very steep penalty. So to remedy this situation, CMS is providing a limited opportunity for equitable relief. Right now, the deadline is September 2019, but it's been extended a number of times, so it's possible that it will be extended again. This equitable relief allows consumers to enroll in Part B outside of their initial general enrollment period with no late enrollment penalty. And if they're already paying a late enrollment penalty, they could get it reduced or eliminated. So Medicaid periodic data matching. Marketplace consumers who have Medicaid or CHIP will get a notice letting them know that their APTCs will terminate automatically. Typically, the termination will happen in the summer. After this, their Marketplace coverage will continue at full cost without APTCs unless the consumer cancels it. Remember that this is different from Medicare PDM. At this time, the Marketplace will not cancel APTCs for people who also have Medicare, although like I said, that might change later this year. But for Medicaid PDM, the Marketplace will cancel APTCs, but will not cancel the plan altogether. The consumer must do that. The notice will tell the consumer what they need to do next. The next steps vary depending on whether there are other people in the consumer's Marketplace application or not. If they fail to take action by the deadline specified in the notice, they'll get a second notice letting them know that their APTCs will be terminated and their coverage will continue at full cost unless they cancel it. Clients who do not want to keep their full cost Marketplace plan should cancel it as soon as possible to avoid any consequences related to unpaid premiums. If there are other household members on the application, it's also important to log into the Marketplace account upon receiving the notice to make sure the Marketplace doesn't erroneously cancel tax credits for people who don't have Medicaid. Also remember that only consumers with minimum essential coverage, MEC Medicaid, are subject to APTC cancellation. So if a consumer who has non-MEC Medicaid, for example, coverage that offers limited benefits, if they receive a notice saying that their APTCs will be terminated, they should seek legal assistance as soon as possible. And these are just some resources about periodic data matching. It has links to sample notices, instructions for responding to notices, information about equitable relief for Medicare, and more. And finally, I want to talk about data matching issues. There's a big change this year related to how the Marketplace will handle income inconsistencies. As you know, the income that a consumer puts on their Marketplace application is an estimate. The Marketplace compares this to information available from sources such as the IRS or the Social Security Administration. And if the consumer's estimated income is lower than the information that the Marketplace obtained from these sources, the consumer might have to provide documentation of their income. So the purpose of this policy has been to prevent situations where someone attests to income that is lower than their actual income and therefore receive a higher premium tax credit than they actually should. In previous years, if the consumer's estimated income was higher than the data available to the marketplace, the consumer did not need to provide verification. The marketplace just accepted their estimate. This is now going to change. So if the consumer's estimated income exceeds the income from data sources, and the data sources show that their income will be below 100%, but the consumer estimates their income will be above 100%, the consumer may have to provide documentation. The stated purpose of this policy is to target people whose incomes fall below 100% of the federal poverty level, but who might inflate their income to receive APTCs. This is primarily relevant to consumers in the Medicaid gap in states that have not expanded Medicaid. As I'm sure you know from your experiences, consumers aren't necessarily nefariously inflating their incomes to get APTCs, but for people who don't have regular predictable income, for example, seasonal workers, self-employed individuals, and people who work multiple jobs, it can be hard to estimate how much they will earn during the year. Oftentimes, they can estimate their income within a range, and it might make most sense to include the top of that range on the application. It's okay to keep doing this, but consumers might now have to provide credible documentation to support this estimate. And remember that consumers whose year-end income ends up below 100% of the federal poverty level, which means they estimated that it would be above 100% on their application, but then they end up making less than they thought they would, they are protected from repaying the full APTC amount due to the repayment caps and the safe harbor that I discussed earlier. That has not changed. Additionally, lawfully present immigrants with incomes below 100% of the poverty level are exempt from this new rule about providing documentation if your income exceeds your estimate. They don't have to provide additional verification beyond what's currently required by the existing rules, since they're actually eligible for tax credits, even if their income is below 100% of the federal poverty level. So nothing should change with regard to lawfully present immigrants in this sense. So here's a list of some types of documents that can be used for income verification, and there's a link in the last bullet here that will take you to a more complete list. You'll find that consumers actually have a lot of options for how they can document income. So it's important to emphasize that clients bring all necessary documents to their enrollment appointment. This includes income documentation, which is more important now than ever because of these new verification requirements. You might consider sharing this list found at the link provided here with clients so they know what types of documents they can bring. And advising clients to bring documents to their appointment is important because it ensures that they can complete enrollment in one sitting and they don't have to come back again. In general, the client can still enroll even if they have a data inconsistency, and they will have at least 90 days to resolve the issue by providing documentation to the marketplace. However, failure to do so by the deadline can result in losing APTCs or losing coverage altogether, depending on the type of data inconsistency. Income is just one type of inconsistency. The goal is always to have clients leave an appointment with insurance and without any residual deadlines. I'm myself a certified application counselor, and so I know from my own experience, as I'm sure you all do as well, that the risk of attrition is fairly high when consumers need to follow up with documentation after they enroll. You're likely to lose people when they have to follow up with another visit or take action on their own at a later time, which is why advising and encouraging clients to come prepared is really important. If someone does need to take action in the future, even after they've enrolled, for example, they have 90 days to resolve an inconsistency, it's best to try to set up an appointment for them before they leave, or at the very least have a system in place for reminding them about the deadlines as they get closer. Like I said before, individuals with incomes below 100% of the federal poverty level who receive tax credits due to an error in how the marketplace calculated their income won't have to repay everything. This is referred to as a safe harbor, and it's important for consumers who say have unpredictable incomes because they're independent consultants or they do other contract work such as driving a taxi or substitute teaching. As a reminder, married consumers must file jointly in order to receive APTCs. Consumers who are considering filing separately should consult with a tax expert to make sure that they account for APTC ineligibility in that decision making. And finally, I wanted to talk about something called gap filling. This, along with the safe harbor, is going to be especially important now due to data matching issue rules for income inconsistencies, the new data matching issue rules. As you likely know, Medicaid eligibility is based on point-in-time monthly income, and Marketplace eligibility is based on estimated annual income. However, some people might have point-in-time income that's too high for Medicaid, but their annual income is within Medicaid levels. So let's say someone is a seasonal worker and they earn most of their income in the spring. If they apply for coverage in the spring, they might not be eligible for Medicaid because they're applying during a month when their earnings are higher. However, they might have very low income during the winter, and their overall annual income might therefore be below 100% of the federal poverty level, which makes them ineligible for APTCs. So this leaves them caught in a situation where they're ineligible for both programs and they can't get affordable coverage. In this case, federal regulations require Medicaid to use the marketplace methodology to determine eligibility. So in other words, Medicaid must consider the annual income rather than the point-in-time income as it usually does. So that is the end of my portion of the webinar. I will hand it over to my colleagues at JSI for an overview of their ACE/TA Center resources. Again, please submit all questions for myself or JSI in the chat box, and we will address them during the Q&A session at the end.
Great, thanks so much, Dory. Can you hear me?
Yes.
Okay, great. So hi, everyone. My name is Molly Tasso. Dory, can you go to the next slide?
Mm-hmm.
Awesome, thank you. And so my name is Molly Tasso, and I work at JSI. I'm a policy analyst at with the Access Care and Engagement TA Center. You might know us better as the ACE TA Center. You can go ahead and go to the next slide, Dory. And I think many of you are hopefully familiar with us and the work that we do, but I do want to take a moment and introduce us and just sort of describe what we do. So we are a HRSA-funded technical assistance center that supports Ryan White recipients and subrecipients engage, enroll, and retain Ryan White clients in health coverage. So we do this through a variety of methods, mostly by developing and disseminating best practices and supporting resources, and providing technical assistance and training through national and localized activities. As you can see here, we have a number of target audiences, Ryan White staff, including case managers, leaders and managers within the Ryan White programs, Ryan White clients themselves, and also navigators and other in-person assisters that help enroll Ryan White clients. So today I'm just going to tell you a little bit about the tax webinar that Dory referenced earlier that we are hosting in a few weeks, walk you through a handful of resources that we've developed to support the tax filing process for consumers and case managers, and then walk you through some resources that we've developed that can help your subrecipients continue to engage clients during this period of time, sort of in between open enrollments. So our upcoming tax webinar is on Thursday, March 14th at 3 p.m. Eastern. And I will note that this was originally scheduled for Wednesday, March 13th, so you may have received, if you're on our listserv, you may have received an invitation to this webinar. It unfortunately conflicted with a recently announced HRSA webinar on ending the epidemic plan, so we rescheduled ours for the following day. So it's happening on March 14th, and if you did already register, I confirmed that you will be all set. You don't need to re-register. So we sent out an email, I think 15 or 20 minutes ago with this new information. We very highly encourage you to share this with share the webinar registration email with your subrecipients and encourage them to register and join us. So during the webinar, we are going to be covering a number of topics. On the next slide, you'll see that we are going to be talking about everything from who is required to file taxes, then talking about how you actually go through the process of filing and reconciling, how to deal with any instances of under or overpayments of APTCs, exemptions, how to provide proof of health coverage, and then getting into some typical policies around APTCs among ADAP and Ryan White insurance programs. and then doing some case studies and walk us through some resources. And NASDAD is going to join, Dory's going to join us on that webinar as well, and give, I think, a kind of similar presentation to what she gave today, but really focused on an audience of case managers, so really helping them prepare prepare for what they are going to be working with clients. So I'm seeing the
I think
slide.
Sorry about that.
No, that's okay. So I'm just going to walk us through
I think it should be up now.
supporting. Okay, perfect. Yes. So here are some. I'm just going to walk us through some supporting resources that we have developed specifically for the tax filing process, sort of tax season, that will really help underscore the points that we're going to be making in the webinar, but that are really designed for case managers and those working with clients to help guide them through this process. So here on the screen, it's a set of FAQs on premium tax credits and cost sharing reductions that is sort of framed as a reference tool to help people better understand the distinction between these two types of financial assistance. We found that this is particularly helpful for case managers or anyone working with a client who has questions about, how their financial assistance through the marketplace works with their federal taxes, and really sort of why are you even talking about my healthcare and my taxes, right? So it helps folks walk through that process and just sort of help explain the relationship there. On the next slide, you'll see we also have a collection of key messages and resources that clients or that case managers might find helpful to prepare and guide a client through tax season and through the filing process. So we provide very concrete information on what forms clients need in order to file taxes, what to do if a client had a gap in coverage or no coverage at all, and then a really easily accessible sort of repository of consumer resources that case managers can quickly access. And then on the next slide, you'll see we also then have resources for consumers. So here on the screen, it's a web-based and mobile-friendly tool, so it works on your phone, that helps clients prepare to file their taxes. So it includes what they need to do based on the type of coverage that they had during the most recent tax year, and then what steps they need to take and what documents they'll need to successfully file those taxes. And then on the next slide, you'll see that for clients who don't have internet or might be uncomfortable using a web-based tool, we've created printable fact sheets that Ryan White program staff can share with their clients. Can you go to the next slide, please? Thank you. And kind of as I said before, there are 3 different versions. Each are specific to the type of coverage that a client had. And the one here that's shown on the screen is for those who had coverage through the marketplace. But each of them really speaks very specifically to whatever coverage type the consumer had, and really just walks them through what they need to know and what they need to gather in order to file. So that is a little bit about our webinar, again on March 14th, and then the supporting tax resources that we have. But I'm going to take just a few more minutes and talk with you about what we have in addition to these resources. The resources that we have that focus on educating frontline staff and clients on what they can be doing to avoid gaps in coverage and care during this time that we are in now. And so this is really the focus of our work and the work of subrecipients and case managers right now, because we're in this kind of this period of time, right? Open enrollment has ended, and it won't really kind of ramp up the engagement activities around open enrollment until the summer. So sort of what do we do in this downtime? So Dory, can you go 2 slides forward? So we think about this, thinking about it sort of more concretely, we think about this as a time during which we can be building the health insurance literacy of clients in order to avoid gaps and for them to make the most of their coverage, to start using the health coverage that they have gained. So we found that there are some key messages that are really important to reinforce, and they are centered around helping clients understand how their coverage works, how they can remain covered all year long, and how to figure out if they're eligible for a special enrollment period if that is something that a need that arises. So again, I'm just going to walk us through a couple of resources that we have to really help support and reinforce these messages. On the next slide, you'll see that this first resource, it's made for consumers. It's called Making the Most of Your Coverage, and it's designed to help clients get oriented to health insurance. And so one thing, so you'll see on the top right, there's a section there about checking your mail. And we've heard from countless subrecipients that major issues arise when clients forget to check their mail or don't open mail from insurance companies or the marketplace. You know, a scary looking piece of mail comes in that you just kind of don't want to deal with. We've all done it before, and then we don't. But then there have then major, of course, implications for not addressing the mail that's coming in. So this resource directly addresses that and makes it very clear, explains to consumers why it's important to stay on top of their mail. It also explains how to use an insurance card, how to contact an insurance company, and the basics of healthcare costs. On the next slide, we have a resource that is called Stay Covered All Year Long. And this focuses on making sure clients understand what they need to do in order to maintain their coverage, such as paying their premiums on time. So relevant to today's discussion on taxes, we know that mid-year income changes that go unreported to the marketplace can cause major issues then if the client is receiving an incorrect APTC amount. And so this resource helps consumers understand what types of household changes they need to report, when to report them, and then directing them to exactly where and how to report them. And then lastly, on this next slide, we have a fact sheet on special enrollment periods. And it's designed to remind Ryan White clients that there are certain life events or special circumstances that allow people to enroll in or change their insurance outside of open enrollment periods. And one thing we did recently, last week, update this resource with the new rules that Dory had mentioned earlier about having some restrictions on the ability to change your meta level. And so that information now is in this resource, and it's been updated on our website. So that is all that I have today. I want to thank NASDAD and Dory for allowing me to join you today. You can see here on the slide, you can sign up on that website, targethiv.org/ACE. Sign up for our mailing list, and you can download and access all the tools and resources there. And I strongly encourage you to sign up for our webinar, and also encourage subrecipients and case managers and anyone else in your networks who might benefit from our webinar to please join us on March 14th. Thanks, Dory.
Great, thank you so much, Molly. So now here's just a list of some resources that we've talked about today. And now we'll open it up for questions. We don't really have very many questions in here yet, but I welcome everyone to please submit them. We have 10 minutes left in our time, so we have plenty of time to answer anything. We've received one question, which I'll answer now. The question was about clients who fail to file and reconcile their taxes, will file their taxes and reconcile their APTCs. To clarify, in this case, the consumer will lose their APTCs, but they will not lose their coverage. So their APTCs might be terminated for this year. They might not be able to get APTCs next year, but they are still able to keep and apply for coverage without tax credits. I'll give another moment here to see if anyone else has any other questions. I see we have some folks who maybe, I see some folks here have their hands raised. If that means that you have a question, then please feel free to submit it through the chat box. We got a question about availability of the slides after the webinar. We will be distributing the slides and the recording of the webinar after it's over within the next couple of days. So for the folks who have their hands raised, I don't want to call anyone out by name, but feel free to submit your question so that we can answer it. Okay, well, so we have a question here that I will field over to JSI, to Molly. Molly, we have a question here. Do you have any suggestions on addressing the issue of clients not opening their mail?
Yes, so off the top of my head, I think one thing that I've heard that has been successful sort of in the field has been case managers encouraging clients to keep a folder, so like just a simple folder like from our school days or a big manila envelope, and just throw any mail that they have into those folders and bring that then with them to any case manager appointment that they have, and then sit down together and go through that mail together. So I think that has been successful in that it takes out the feeling perhaps that a client is doing this on their own, or that they're opening all this stuff and needing to figure out exactly what it means, what they need to do, how it all works together. I've heard that sitting down together and working through that has been helpful. I've also heard case managers say that they have, like if an insurance company is sending out, if many clients are getting the same letter from an insurance company or from the marketplace, they have made copies and de-identified any information, but they've made copies of those letters and kept them for themselves, just as a sort of reference point if a consumer or a client comes in and may just to familiarize themselves with the mail that their clients are getting. That has been helpful. I know in some places, if there is a client who perhaps is experiencing homeless instability or housing instability, they will make sure that all their mail is directed to either PO box or even like their healthcare clinic or wherever their case manager might be employed. That's been successful in some states that has been allowed to take place. But I really think just hammering home the message that it's very important to open your mail, but that you aren't doing it alone. You can come in and work with your case manager to sort through what you're receiving and what you need to do.
Great, thanks, Molly. So we have a couple more questions here. First, a question about the new rules for special enrollment periods. The question is whether this new rule applies only to enrollees who are attempting to switch their plan, or if it also applies to enrollees who've been automatically enrolled into a metal level. So I assume this question is referring to situations where a consumer has been like the plan crosswalked into a different, or I think that's the term for it, enrolled into a plan automatically because maybe they're through auto enrollment because maybe their plan wasn't available anymore. My understanding is that it doesn't really matter how the consumer ended up in a plan. It's just that whatever plan that they have, they end up with when open enrollment is over. Let's say they're in a silver plan, regardless of whether they were automatically enrolled in it through auto enrollment or they chose that plan themselves. If they receive if they are eligible for an SEP later, they will only be able to switch plans within the same metal level, with some exceptions, but most of the most common SEPs are subject to this rule. And then we have another question here that I will actually field over to my colleague Amanda Bose from NASDAD, who's also on the call with us. Amanda, the question is about, can you expand please on how to refer clients to professional tax advice? How can this be done while steering away from endorsing a particular brand or company?
Thanks, Dory. So to clarify, so I am aware of at least one jurisdiction that has actually contracted or worked directly with a particular tax preparer. In that instance, it was H&R Block, to help clients in terms of filing their taxes, et cetera. I mean, I think it would be helpful to understand if from your from your particular jurisdiction, if you have rules in which you cannot particularly endorse one tax referral company or another. Based off of what I understand from HRSA, I don't think that there's necessarily anything inherently wrong with recommending a particular provider or a couple of providers or working directly with them, for them to understand the role of ADAP in terms of their tax filing, et cetera. But that is something that I think other states have done in the past, is work directly with a preparer or a particular brand or company. But otherwise, I mean, I would imagine, like most things, you can provide some contact information for a couple of vendors if that's what's more preferable to you, and some guidance to them about the kinds of materials and documentation that should be shared with them, from your perspective as an ADAP. But I don't know if JSI or you, Dory, would add anything else to that.
No, I think that sounds accurate to me. Anything, JSI?
Nothing for me.
Okay, great, thank you. So we have 3 minutes left, and I have one more question here that I'll answer. So we have still 3 minutes, so feel free to squeeze in a few more if you have any. We have a question here about retroactive Medicaid coverage and whether this affects APTCs. So I will verify this, and if I end up somehow being incorrect, I will send an update. But my understanding is that it doesn't matter whether the Medicaid coverage is retroactive or not, because if someone receives retroactive coverage, then that means they were eligible for Medicaid during those months, and anyone who's eligible for Medicaid is not eligible for APTCs. And so those months during which the retroactive coverage would apply are months when the person was eligible for Medicaid. And so the same rules would apply as to my understanding. But I will, if I am incorrect about that, I will provide an update, but that's my understanding of the rule. So we have 2 minutes left. If anyone else has another question, feel free to send it now. And if not, then we'll give you back the last minute or two of your time. Okay, so it doesn't seem like we have anything else coming in. So unless Molly or anyone else on the panel has anything else to say, I think we can let folks go a minute early.
That works for me, Dory.
Okay, great. Thank you so much to everyone for attending. Please look out for an email with slides and a recording and an evaluation for this webinar. And have a great rest of your day.